The elderly are some of the most vulnerable people in our society, but for some of us, they're not just the elderly, they're loved ones.
Had lost the ability to walk, to talk and to swallow, so it was then I realised how vulnerable he was.
Julie Spring is a teacher in Melbourne. She also had a difficult experience with her father in aged care.
Suddenly, in a period of, I don't know, maybe 10 days, just shrunk to a skull, and I was really shocked because he was so clearly in a really, really bad way.
Her father died from urosepsis, which occurs when a urinary tract infection spreads to the kidney and then into the bloodstream. He had been living in a nursing home for around 18 months.
He's in a delirious state and then rushed to hospital on the Sunday, and he's diagnosed as having septicemia, and we're told he's dying. This wasn't a recent development. It had actually been going on since December.
Nursing homes are officially known as residential aged care facilities. They can be large for-profit homes, private one-off or family-run businesses, and even charitable church and not-for-profit homes. More than 195,000 Australians live in one, and around half of the residents have dementia.
When families had 5 or 7 days to find an aged care home, that fear, that anguish, the stress that they're put under would ask us as health professionals, which facility would you choose? And the main way that we would actually determine if a facility was good or not is if we didn't get any negative feedback from families that we'd sent there, then we just keep sending people there. And I just thought that system, we could definitely improve on that.
Anyone that has worked in aged care knows the all too familiar horror stories from residential care and a general widespread reluctance to move into a nursing home.
I've worked in aged care facilities and also in the hospital settings. Customer experience wasn't a priority in facilities. They just were so busy doing other things that the customer, the government was one of the biggest customers for operators.
A review into the national aged care quality regulatory processes was announced this year, following a scandal at multiple Oakden aged care mental health facilities in Adelaide. These scandals involved the death of a resident at the hands of another resident, allegations of restraint and abuse, neglect, and over-medication.
We welcome the Minister's review over the events at Oakden. We are really concerned that the over 400 submissions to that review have not been published.
The Minister for Ageing, Ken Wyatt, said this in a statement. A task force, chaired by Professor John Pallairs, is currently being formed and will be supported by a $2 million 2017 budget commitment. The Wyatt Review's findings and the Minister's response is due to be released this month. The Wyatt Review of Regulatory Processes is just one of 4 prominent reviews of our aged care system: an internal investigation by the Quality Agency, an ICAC investigation in South Australia, and a Senate inquiry into the accreditation framework are all reviews that have been announced this year.
Recommendations have been made by groups like Aged Care Crisis, but the same long-standing question remains. Will the government take up these gutsy recommendations? And will these reviews, which are conducted behind closed doors, leave us once again with more questions than answers?
Not many of the reviews have really targeted actual delivery of quality of care to residents in aged care.
Preventable deaths in nursing homes have increased by 400% over the last decade, according to a report by Joseph Ibrahim, published in the Medical Journal of Australia.
There are deaths from clinical care, deaths from choking, deaths from suicide, deaths from interpersonal violence. And if any of those things occurred in the workplace, there'd be a huge outcry.
But not everyone's complaining. The Federal Minister for Ageing, Ken Wyatt, described Australia's aged care as world-class.
When really there is no actual evidence of Australia's world-class system. The government doesn't actually collect and publish data to confirm the class system that claims that are being made.
That no one's really paid any attention to it is the first thing. When you reach the age of 65, your life became worth nothing, and as you get older, it was worth less than nothing. So it's not counted in the statistics. And so we'd already set the system up not to count those deaths as part of a public health problem.
So, is the aged care system in crisis?
We're really comfortable with saying it's an aged care problem because we imagine that we're never going to be 90 and we're never going to need it. And so I don't think we care about it as much as we should.
We believe there is, and we've documented what we believe are the systemic issues in the bulk of our submissions to various inquiries and reviews, and we are very concerned about the future of aged care.
It's a systemic issue, and that because these facilities are all run around, profits, they have a skeleton staff who do have expertise. They have, one nurse to 90 people.
I guess the best answer is there isn't a simple solution to a complicated problem. And I think my frustration is that we keep looking for a simple solution. Yeah, and the more staff, more money is a simple solution.